Hey everyone. So my patient was admitted on October 16th with complaints of increased cough, shortness of breath, and fatigue. She was admitted to CAMC Memorial Hospital. She was a 66-year-old female and was diagnosed with respiratory distress. She also had a CT scan of her chest done during her stay there, and it did show that she had multiple lung nodules. She does have a history of COPD. She used tobacco for 60 plus years. She told me she normally smoked between 1 to 2 packs of cigarettes a day. Again, where she had the lung nodules, they went ahead and done a bronchoscopy. I know I say that word wrong, but with a biopsy, and those results was still pending when I left clinicals that day. Some of the medications she was on is she was taking albuterol 2.5 milligrams via nebulizer 3 times a day, and she also had albuterol 2.5 milligrams every 2 hours PRN for increased wheezing. She's also taking dexamethasone 4 milligrams PO every 6 hours. Her allergies was aspirin, shrimp, and Spiriva, and her primary care physician or hospitalist was Dr. Morella. So during my assessment, again, she complained of increased cough and shortness of breath normally in the early morning hours. She said she was normally waking up about 3 a.m. and was getting, basically, as she described it, she was having a really bad coughing fit. She felt like something was really thick and hard in her chest, and she just couldn't cough it up. But she would have a few cups of coffee, hot coffee, and she said it seemed like it loosened things up, and she was able to cough some of that up, and throughout the day she would get better. So mainly she just felt her symptoms was worse in the early mornings. When I auscultated her lungs, her upper lobes was very coarse, and she was very wheezy, and her lower lobes again was coarse, but they was diminished. Her vital signs was pretty stable. Her blood pressure was 120/82, respirations 18, temperature 98.5 degrees Fahrenheit, heart rate 95, and her oxygen saturation was 95% on room air. Her blood sugar was a little bit elevated, but I think that was due to just her being on so many steroids. She told me she does not have a history of having diabetes, but her blood sugar was 176. She did not have any fever. Her current lab, her white blood cell count was a little bit elevated. It was 13.9. Her ABG levels was pH of 7.45, PCO2 44, PO2 66, and HCO3 28, O2 93. So really those wasn't terrible ABG results. Again, her lung sounds was coarse, wheezy, and diminished. She was on room air during the time that I helped take care of her. Her skin was intact. She had a 22 gauge to the right forearm that flushed easy, and did have a good blood draw. She didn't have no wounds or no Foley. Her last bowel movement was 10:24, and her abdomen was soft and non-tender. So recommendations would just be to monitor and assess her respiratory status frequently. She did have her biopsy results was pending. Earlier that week, she had radiation done. She had a mass that was partially blocking her airway. So they went ahead and done radiation on that to shrink that airway to help keep her airway patent. Again, maintaining patent airway, keeping her comfortable. The priority assessment would be just her respiratory system. For education, you would just want to educate her on diet, just because the steroids will increase her blood sugar level. You would want to notify staff and the physician of worsening symptoms, again with shortness of breath, coughing, wheezing. You'd want to educate her to try to quit smoking. She was wearing a nicotine patch during her stay at the hospital, and she did tell me that she would like to quit smoking. You would want to maintain adequate hydration also. Some possible orders for the day would just be any type of respiratory treatment. Again, her albuterol treatments and her PRN albuterol treatments for increased wheezing. If her oxygen saturation levels would start to drop and get low down into the 80s, you'd probably want to obtain another ABG level. You'd probably want to check some more chest x-ray to make sure there's no changes She did have future appointments for the following week. They kind of did clash together, so you'd probably want to notify the social worker or whoever would be involved in that on trying to get her appointments more spread out and not clashing together. She did have a PET scan that was due Monday, and then they was going to determine that on whether she was going to have palliative care, do radiation, or chemo treatment. It pretty much just depended on the PET scan that she was going to, the PET scan results. So one thing that I liked about my clinical experience that day is I really liked the nurse that I worked with. She was really good at trying to teach me stuff, and I really liked my patient. With already being an LPN, I don't feel like you get lucky on having really good patients all the time, and I'm sure that'll be the same once I'm an RN. But my patient was really awesome. She was very grateful and just sweet all around. She was just a good patient to take care of. Something I didn't like is that it is hard to get into the student mode with me already being an LPN. So there was things, of course, that I would want to do that I wasn't allowed to do as a student. So that was a little difficult right there. So something I learned, this was actually, was possible COVID on the first time that you guys went to the hospital. So one thing that I did learn during this clinical experience was the documentation with ATI, which I thought was really cool. So that's all I got.